Hi. Good morning.
Hello, everybody in Strictly Education and Support. And if you haven't met Carla Wrenn before, Carla Wrenn is an amazing naturopath. You've been a naturopath for 20 years now?
Nearly 20 years, yeah.
Nearly 20 years. And she owns and runs the Peninsula Herbal Dispensary down in Mornington Peninsula. So that's just down, if you've not been to Mornington, it's south of Melbourne. It's on the coast. It's absolutely beautiful down there, and it's a little village. You've got a shop right on the main street and people can come past.
Yeah.
Now obviously it's been a bit interesting and difficult for you in 2020 because Melbourne had the super lockdown that no one else in the world decided to do.
I'm not sure if I'd call it super, but
okay, extreme. I don't know what to call it, but it was definitely an intense lockdown for all of you guys in Victoria that none of the rest of us went through. And we're very grateful to you because it meant that, you know, you did it, you showed us it can be done, and we've got through all of that. But it must have been really hard for you because your business is an amazing business. It's been running a very long time, hasn't it? And you've got six.
There's 7 of us now. So we even employed during COVID lockdown. So that was exciting. So there's 7 of us now.
Wow. And you have a unique situation where you do acute dispensing at the front counter, and the girls at the front counter are the naturopaths. Everyone rotates round through that poster, and they'll see clients. Right. They rotate to the front counter, they see clients. And you always have 2 on?
Yeah, 2. And we're kind of in the position where some days there's 3 now. So yeah, 2 or 3. Yeah.
Wow. And so they're making for the person who's sitting with the client. So they're creating prescription as well.
Yeah, so they do a mini consult that lasts around 5 minutes. You know, it can take longer in some instances. Not everyone's suitable for those acute consults. So in that time, we figure out if they're suitable for it. And the naturopaths, they're all naturopaths, will dispense something that they make for them. It might be liquid herbs, or it might be a supplement, or a homeopathic, or a cream, or a tea. So it's that old school apothecary vibe that we have going on. And then, yeah, the girls eventually progress from there when they want to into the dispensary clinic. So we have that naturopathic clinic running. And yeah, the business has been going since 2004, but I've had it for about 6 years. So yeah, lots of fun. Yeah.
So it's amazing. I mean, it's a beautiful space and it's absolutely amazing spot. So I don't know if the people watching have listened to my podcast, but I've just put up my podcast, 3 Mistakes in Business. And one of those mistakes was opening in a really bad spot. So yes. You've got an amazing spot. You've got lots of people walking past, a wonderful window, and you have lots of wonderful things in there. So, but people who are just starting out tend to be in this group and tend to listen to me more. And when we're starting out, we have imposter syndrome. But when we've been in business a long time, we still have imposter syndrome, don't we?
Yes, definitely. When you suggested this topic, I thought of an instance where I was thinking that the other day. So for sure, I don't think it ever goes away. I think we just get better skills to manage it and better tools to manage it.
Yeah, and we've got more of a support network once we've been doing it for longer. Like, you know, I can call you, we can call each other. We've got groups of friends that we know that have been in the business longer, and you know, I've got the academy. People can ask in there. There's always that space once you create those connections. So, but it's something that I think haunts us all. And I'm currently doing a course online, and the woman online, she put up it's called a reel, isn't it, in Instagram, and she put up a reel going, my clients don't hear from me, they don't know. And then after the fact, they'll say, oh, how did I miss that? And she's like, I've been emailing, I've been on Instagram, and yet we don't, as practitioners, contact our clients enough. We don't email our clients enough. How often do you send out emails to your clients?
Oh, look, we're really bad at it. It was one of the things that we strengthened in 2020. We just haven't done it. It's one of those things that are on my to-do list. Like, I would love to say that the Herbal Dispensary sends out monthly newsletters, but they're normally more quarterly. But over COVID, obviously, when we had to shut down, kind of in 3 separate instances, we shut down in 3 different ways, or kind of 4 different ways. That was one of the things we relied on, the emails that we had initially to communicate what we were going to be doing, and then communicate how we were continuing to offer our services. So yeah, it's definitely something that in 2021, you know, we want to bring more of.
Yeah, communicating with your clients and keeping up that motivation and discussion. I know Jules Galloway, we were talking with her the other day, and she said that she emails fortnightly. Yes. Because she finds that that's the right amount to make sure that people don't unsubscribe, but also stay interested and don't unsubscribe because they've forgotten about you.
Yes.
So what I'm trying to do weekly
Great
at the
tip,
moment.
Jules.
Yeah, I'm trying to do weekly. It's killing me.
It would be really good for someone to do the cost comparison on the time that it took them to do that kind of newsletter and write that kind of content versus what they made out of it. And that might give us some ideas about how many times too. But what I always get surprised at is they're happy just it can be simple, like a recipe, or, you know, what's going on in the clinic or what I learned at the last conference. It doesn't have to be as well thought out as I think we sometimes think it has to be, and like some referenced, you know, article.
Now, I'm sorry I'm moving around. I'm in a hotel room in Port Lincoln, and you're sitting on cushions on my lap. So it's just.
That's right. I feel like I'm on holidays.
Yeah. Well, everybody is on holidays. So that's why it's the perfect time to get hold of someone like yourself who works a lot, to be able to squeeze 5 minutes out of you, or well, preferably half an hour, and now be able to talk about, because what you have Veta Mosaic for practitioners, because you've been running this business for so long, because you've been seeing all these clients, you decided to go to America and really increase your learning, didn't you? So can you tell us about that? What did you do?
Yeah, well, it definitely came back to that idea of imposter syndrome, because I started to practice in what was already quite a successful business in the dispensary. I'd practiced other places first, but I kind of, you know, I was like 2021 when I graduated. So, you know, I think age can give you that imposter syndrome too. And I was really looking for the next step. And I very much saw the dispensary as a big leap, and to be a much more professional situation than what I'd been going on and doing previously. It's like, for me, it was when you look at that dream clinic that you'd love to work at, that was where I was going to work. So I definitely had that imposter syndrome, and there was another naturopath there that was very busy already. And so I thought, how am I going to get clients? What's my area of difference compared to hers? And they really called her like the touchy-feely, like she was very into the Vega machine and very into kind of more of perhaps a spiritual approach to healing. And she was a fantastic practitioner and was very well loved, but I needed to do something different, I felt. So I decided to say that I love the complex cases. And the owner of the dispensary at the time, Karen, called me the scientific naturopath. Right. And God, if anything's going to give you a need for imposter syndrome, it's being called the scientific naturopath. It's a little bit different now. Remember, when you graduate, you have a different kind of level of qualification to what we had. I had the degree, but I still didn't feel especially scientific yet. This was probably around 2000 and I don't know, like 8 or something like that. Yep. So, you know, I still had more to learn. And so that was when I led to my need to kind of look for more information. From when I started to when I went to the US, though, was a number of years. I didn't go to the US until 2015. And in that time, I looked for ways that I could overcome the imposter syndrome. And I had this thing like fake it till you make it. You know, I had young babies at home. I would kind of put on high heels. And if you know me, you know I'm tall, I don't really need high heels, but it was a way, and put on lippy, and I wouldn't take a big handbag, I'd take a little clutch purse. And that was because I was trying to separate myself as a mum of like newborn and a 2-year-old, and kind of increase my confidence around being the practitioner I wanted to be. So I definitely had that fake it till you make it. And so while I was working in this complex cases, I needed a solution that enabled me to better deal with the patients, because I just didn't feel like college taught me how to deal with people when they had complex cases. And I'm sure you find this with your academy. You know, people or graduates are full of amazing knowledge. Like I love graduates. I love having new practitioners in our clinic because they have like the cream of the crop information. But when someone comes and they've got type 2 diabetes, depression, they've got a family history of rheumatoid arthritis, and they're starting to get sore joints, and they just had a miscarriage and they want to get pregnant, I was a bit like, oh my
God. Totally a complex case. You know, everything is happening, and you've got, you know, everything, and you've got all the drugs as well. So not
Let's
only
just
have
say
they got all
have,
these things.
yeah, they have type 1 diabetes. That would fit my picture better. But, you know,
Yeah.
we can all deal with type 1 diabetes. We can all deal with depression. But when they're all together, you know, you might be the fertility guru, and that's awesome. But when the patient comes with type 1 diabetes, rheumatoid arthritis, and depression, you've got to think outside that picture and what could be going on as some drivers underneath. And so that's what I saw the functional medicine practitioners doing. And people like Dr. Mark Hyman and Jeff Bland, their books and the videos that they did on Facebook. I watched things like this that they did. And that led me to, spend 10 grand, which was a lot at the time. Well, this is still a lot, but a lot at the time for my family to go over there and learn some of the tools and resources that I was able to bring back, and then over time evolved into Vita Mosaic.
Yeah. So Vita Mosaic, I mean, I did the course. When did you start it? I did the very first round, I think. So how many years has it been going? 3?
I think 2018 I started. Yes, you did the second event. I did an event in Melbourne, and then I went to Adelaide. So
that's right.
yeah, it must have been around February 2019 or something, maybe. I can't remember. I get confused.
That must have been 18.
Feb 2018. Yeah.
Because I've visited you over there twice since then.
Yeah,
so
it must have been Feb. Yeah, 2018.
So a while. But because what I like about it, when I work with new graduates a lot, the graduate program, which launches in a couple of weeks, is all about making sure that you've got everything for your clients and you're all ready and you can go with it. But the special thing about Vita Mosaic is it beautifully fits in with Simple Clinic, of course. So if they've got Simple Clinic, they can use the notes so they're dynamic. But you have dynamic paperwork.
Yes.
For the clients. I mean, it's just like dynamic paperwork as well as the training that goes with it is really special. And here you are, you've moved from being someone who says, I'm going to put on high-heeled shoes so I feel like I'm in control and I can do this, even though I'm 6 foot. You ask, is it because you feel taller than me?
I feel like I'm shrinking, but yes, I say I'm 6 foot. Yeah,
don't worry, we'll shrink it equal amounts. So we'll always probably be the same difference for a bit anyway, although I'm older than you. So no, that doesn't work. The mathematics there just doesn't work.
I thought you were 21, but anyway.
No, 30, just a mere 30.
Perfect. That means I was a naturopath since I was 10, but that's fine.
Yeah. Well, don't worry. It means that I was actually practicing as a nurse and naturopath before I was born.
Anyway, our age could be something to do with the imposter syndrome. Yeah.
Back on track. So yeah, quite a lot of the imposter syndrome. But here you've gone from someone who said, I'm going to wear a nice dress, I'm going to wear high-heeled shoes, I'm going to carry a clutch, so that I have I have a split personality. And I'm going to go and I'm going to be in the place I want to be in, whether I have clients or not that day. And then I have to be something else. You were invited to be the scientific naturopath, which would have freaked you out, total imposter again. And then you're like, okay, how am I going to do this? The only thing I can find that will suit me is a course in America. I've got new children, I've got little babies, and I have to go there to do it. It wasn't online. You actually had to get on an airplane, go there, stay there, do it. So it wasn't just fine. It was 10 grand for the course, but it wasn't just 10 grand because you had flights, accommodation, you had all the things that go with it. So chances are it was closer to double that. And it would be double that if anyone was to do it now anyway. And so you brought all this information back. You started using it. You started sharing it with everybody once you'd bought the dispensary, started sharing how to use these forms, how to use this. Your husband is super techie, so he was able to create pretty forms. So they do look very pretty. And then they can be rebranded. So someone like me could use them who isn't with Simple Clinic. But then now you've turned it into a course and you're teaching how to use all this stuff so people don't have to spend what would be at least 20 grand to go to America and learn this stuff. I mean, when I count up how much education and training I've got, but I was always in that place. I never flew anywhere for anything. I was in England when I trained to be a nurse. I actually stayed in halls of residence, so I was like attached to the hospital. I was right there, always available on snow days when no one else could turn up. Students went in. But you went and you did this and you've created these forms. And I thought, you know, you're in there with the client. So somebody wants to do the Vita Mosaic course. It's starting really soon, isn't it? It's starting.
Yeah, the next one's Feb 4.
Feb 4. So, which is really cool. I've actually got a challenge going in my group from the 1st to the 5th, and you've got yours starting on Feb 4. How long is it for, the course?
It goes for 6 weeks. Well, it goes for 6 modules, and we say that's over 6 weeks, but we allow a couple of extra weeks, so 8 weeks in total to kind of complete it all, because I really want people, and I'm sure that you're the same with all the things you produce, you want them to really get it. And so, yeah, we have a good amount of time to get it all done.
Yeah, totally. So I mean, with the graduate program, it's all about being out in practice and all the different clients, and we go through, and it's making sure that everybody understands. So it's it's because we've both been doing it a long time, we both understand just how important it is that everybody understands what we're teaching and that they take it on board, because we know how busy everybody is. We've both got children and all the rest of it and working, you know. So but I thought we'd talk as well about this imposter syndrome, but also some of the little questions you ask your clients when they come in, some of the little tips and tricks that make things go that little bit more smoothly, you know, in practice. So they walk in the door, and what is the first thing that sort of comes to mind when you've got that diabetic, osteoarthritis, wanting to get pregnant, depressed person walks through the door, apart from hello?
Yes. Hello. Well, I guess there's a couple of things. The first thing in functional medicine, the first step we take is gather. And so that really, I find, is also a great way to center yourself. The first step is gather yourself. And I heard a practitioner, I cannot remember who it was, but it was one of Australia's top practitioners. It could have been Leah Hackman, talking about having an altar that she looks at before she sees her patients. Have you heard this story?
I think Moira has an altar as well.
Oh, maybe. Well, so hopefully maybe it's Moira, but anyway, they have Mother Teresa on there and other people, that Oprah, people that inspire them. And they kind of think about, and other healers that inspire them, and they look at this and center themselves before they see the patient. I think that's one of the biggest things, being able to just take that moment to think, I've got this, because you have, and the patient in front of you is going to be so amazed at the knowledge that you have, no matter if all you can remember them. And this is what I say to the girls in the dispensary when they first start. If someone comes in and they've got a cold or a flu and all you can think of is echinacea, that is a million times better in the connection that you have and the way that you talk to the patient about what you're giving them and the other maybe lifestyle suggestions that you give them than what they might get if they go to a health food store or a GP. And so, you know, just embrace the knowledge you have and gather yourself. And the next step of gather is the timeline. And so anyone can get a timeline. And if you didn't do them at college, you know, the simplest way to think about it is get a bit of paper, draw an arrow. And start at the beginning. No, start where the patient is now, at the beginning of their story. And I really think of that patient as someone telling me a story. We can all sit down with a girlfriend or a family member and listen to what's been going on for them. And that's what I want to have flow with my patients. You know, I always start by saying, you know, we're going to talk about what's concerning you today, a bit about your overall health and what your goals are. And then we'll make a strategy. And if we need supplements or testing, we'll talk about that. And I say, so tell me why you're here. And I start writing that at the arrow end of the timeline, the present. And then I just try and get the story to flow. And I use that tool in Vita Mosaic. We teach this, that you use that tool to help the patient also draw out the information they need. You know, ask them if it's relevant about their mum's health before they were born, or her pregnancy with them, or their early years, because in those complex and chronic cases, the information that we need is often there on the timeline, and it's not the kind of thing the patient's going to think to tell you. You know, I want to know about that time they went to, I don't know, Africa, and they got some weird parasite, and because that probably has something to do with what's going on, but it's not the kind of thing they're going to think to tell you, and the timeline can help draw that out. And if all you try and do is just finish that timeline, even in the first consultation, take a really good case and give yourself some time to think about it later, you still overcome that imposter syndrome because you've got the notes you need, you've created a nice connection and rapport with the patient, you've shown them your skills, and they leave happy. And so I think, you know, it's in you. We just need to figure out a way of bringing it up. Can I share one of my favorite quotes quickly?
Yeah.
So I use it in Vita Mosaic. You would have heard it before. It was the Adelaide Crows women's AFL coach who said it. So not very naturopathic and not very clinical, but she said, we don't get nervous, we get ready. And that's what you're creating and what I'm creating with our courses. We're trying to help practitioners be ready for whatever comes in their door.
Totally. How long is your first appointment when you see your clients for the first time?
If it's a complex case, it will definitely be an hour, possibly even an hour and 10 minutes. And I'm not afraid if I feel like, oh my God, I've got no idea what's going on, or I've got some concerns, to say to them, I'm going to do some work on this and then I'm going to get in touch with you later. And the same if I give a treatment strategy and I'm feeling like there might be some more information that I want to give, but I can see them starting to feel overwhelmed or glass over, you know, that look where you're just like they're at maximum capacity. Then I'll say, look, I'm going to get in touch with you in 7 days. And if there's anything more we need to go over, then I'll mention it then. Otherwise, I'll just check in with how they're going. If it's what I call a normal case or a more simple case, sometimes it's half an hour. And, you know, I do charge according to that. I'll always schedule an hour. But if I think, well, that was a little bit more simple, then we might not use as much time, or I might encompass their follow-up consultation into that initial charge and make sure that they get value for money.
Yeah, because what I notice a lot is because everyone had an hour and a half in college, and they'd often go overtime trying to find the lecturer and trying to get support and all the other things. They will do that in their home practice, but it's only one-on-one, and it's, you know, it's you and the client, and there's no one else there. And that's really overwhelming for the client. An hour and a half in college is fine, because you're only with that person for 40 minutes, and then they come out and then they'll go and have the iris photographed in the, you know, in the dispensary or something, and then they'll go and sit. So they actually get a break. They get to walk around. Whereas when we've got them sitting in front of us, we really have to take note of that glazing and of that exhaustion and of their body language. You know, you can get a lot of body language when they walk in, and Katie Redanza talks about that all the time. You know, you know, you can see the color of their skin, their torpor, how they're feeling. You know, your depressed person is going to be slumped. There's not going to be a lot of eye contact, all of those things. You see blood pressure with, you know, different color of the ears and all sorts of things, and the nose. And so there's lots of things that we see visually, but remembering to spot that glazing. I remember my first one that glazed. I was like, oh, what have I done? And I was like, are you tired? I was years ago, and I went, are you tired? And he went, yeah, I don't think I can do anymore. And he was massively complex. And I was like, you know what? I don't think I can do anymore either right now. I think I have to go away and research all of the things that you've told me.
Yes. And you know what, that man, he would have loved that, because they come to us very often in a complex situation, having been to lots of other healthcare providers. And I think if you, I don't know the stats now, but they used to say an average doctor's consultation was 7 minutes. So if we're seeing someone for 60 minutes, that's nearly 10 times more than the doctor's appointment. And imagine having 10 doctor's appointments, you would be exhausted, you know. And so I think if you say to them, I'm going to do some research on you, and they've been to see everyone else and no one said that before, they're going to love that. And it's a great way to get over that syndrome, because as soon as the patient leaves the room, have you ever felt this? It's like all the ideas shoot into your head and you're like, why didn't I think of that when they were in here?
And I never asked that question. And what about that? And so you just take those notes, and when you see them next time, you can write down all of, you know, it's like, I've got all these questions, you know, I just wanted to go through this extra bit with you. And they're thrilled. They're thrilled. That man was one of my first, he was 10 or so years ago. He's referred me heaps of people.
Yes, that's right. And I think that's one of the other strengths of Vita Mosaic with the Mosaic Spectrum Clinical Guide. It's the book we put together. And I remember you added a lot under the cardiovascular system, but there's all the different areas of the spectrum are covered. And over all of the courses that I've done, and I don't know, it might nearly be 500 pracs now. We've added information into that Mosaic Spectrum Clinical Guide, and it's literally got questions to ask. So I don't really suggest pulling it out and asking them in front of the patients. Like, it might look a little bit weird, but you can check that later and think there's something I'm missing in this area of questioning, and you might get it on there. Or I often send them questionnaires later and go, hey, when I was reviewing your case, because I usually tidy them up each night or at the end of a day, and I just say, I forgot to give you this questionnaire. And I love that, because it shows you were thinking about them, not just in the time that they paid for, but in the time afterwards as well. So don't be afraid to follow them up. And like, sounds like what Jules said, you know, they like having that connection.
They do. My husband, the reason we're here for a week is my husband's just had surgery, and his surgeon phoned him at 3 o'clock on Sunday afternoon to check on his progress. So we're not, you know, the other industries do these things. They follow up as well, and they follow up at odd times. And he was thrilled. He's like, oh my God, I don't phone my patients at 3 o'clock on a Sunday afternoon. I mean, he sees us all the time because they're in the hospital. But, you know, it's that same thing, following up, answering, replying. I have an automated email that goes out to everyone after I've seen them 24 hours later. And it says, if you've got any questions, email me back on this one. But again, I will email them, oh, here's because I will do the same. Now I'm all on Halaxy, so I will send then questionnaires from that. Once I've finished the consult, I will send their, you know, what I've written about and what I want them to do. And having everything there that you can send them, they're through, oh yes, I did get it. Oh, I got all that, thank you. And yes, oh, I'll see you next time. And they come back, because it's, you get that as you're going through with them, you get that rapport. And by building that rapport, the rapport itself means that you lose some of that imposter syndrome. You'll always have it. Like, we've still got it, everyone.
Oh, totally.
Everyone listening, we've still got it.
I'm writing a lot of presentations at the moment for things I'm doing in 2021. And sometimes I still sit there and think, can't believe I'm doing this. Should I be doing this? Am I the right person to? And then I have to just, one of the secrets I think that I had early on too was just always say yes. So, you know, if you get that really complex case and they come in and you don't know what to do, saying, I would recommend that you start with these steps, and maybe you give them some dietary and lifestyle steps. And then I would like you to see another practitioner in this area who specializes in this area, and you write some really lovely notes for that practitioner and forward it to them, so that when the patient gets there, your details are there, then that patient's going to feel so valued. You've created a great rapport, and they're probably still going to refer to you. They're just going to know that that's not your special area, but it doesn't mean that you failed or you didn't live up to what you had to do. And so I think if we always say yes, there's really no downside. What can go wrong?
You can't go wrong. Always say yes. Yeah, that's probably the top of this one, isn't it? It's always say yes. So we were talking about everything we've both got on offer, because when will you be delivering the Vita Mosaic again later in the year? Do you do it twice?
I do it on demand. Some years I've done it like 5-6 times every month, kind of a lot. Now that we're online, it obviously means everyone can come from all different places. So I started doing online in 2019. Thankfully, I was ready for 2020. But so we probably do it a couple of times a year, and it's on demand. So I wait until there's enough people asking me to do it, and then I pop it on. So at the moment there's just Feb scheduled, but I'm sure other things will come up later in the year. And I look forward to the day when, you know, we can do some in-person things as well.
Oh yeah, I know I had in-person things planned for 2020, and because I've always been online, you know, mentoring. So for me it's like, oh, I'm going to do this. I'm going to have an in-person. I'm going. No, and then I was like, okay, I might make it in to the ATMS Menopause Symposium in Sydney this coming. Well, we're in, as it's turned out, we're in Port Lincoln, because of course you can't go to Sydney and it's gone online, you know. So it's like, maybe. I
can't wait for that day. We'll all be so excited when we get to see each other in real life at a conference, won't we? Sample all the tablets, have the morning tea, have the lunch. We'll never complain about there being too much food again, will we?
No, we'll never complain about the food again. We'll never complain. We'll be like, oh my God, it's been so long. No, in 2019, I went to tons of conferences. And then I was like, you know, 2020, I'll do some of my own. And then 2021, it has to calm down. So this year had to calm down anyway. My daughter's in year 12. But it's just like, and now it's like, well, I still can't go to anything.
Next year, after she's finished year 12, we'll be able to
after she's finished year 12, I'll be visiting everyone. Because I was also thinking with my academy, what might be nice for the people who've gone into your Vita Mosaic, why don't we give them a bit of a special to come into the academy?
Yes, that sounds amazing.
So at the moment, it's 7 days free. It's always 7 days free, because that's, you know,
that's such a great idea.
So why don't we give them a couple of months?
They would love it. That sounds exciting. Thank you.
Let's do that. So if you do the Vita Mosaic, you get to come into the academy for a couple of months for free.
Perfect.
So I mean, obviously, I'd like people to stay after that. But
I'm sure they will. They're going to get all this amazing knowledge from you.
All this amazing knowledge. Because I mean, people who are going into the graduate program, that's very different. That's like, it's not like the Vita Mosaic, but it is like it in that it's a longer course, but it's very specific about, your practice and your clients, and it's clinical, whereas the academy is not clinical. And so of course it would complement Better
Yeah,
Mosaic
it ties in
really
so
well,
yes,
because that's the clinical. So I've
yeah.
got my clinical, ooh, my cushions are on the move. So that would complement really well, because it's not the clinical side, it's the support and the, you know, that imposter syndrome and all the other things, getting yourself out there. So it would
Do you know what I
complement
think?
really well.
Yeah, what I think is worth pointing out about that too, and people like yourself and other people who stepped into that mentoring role for graduates, is I clearly remember when I came out, I was very fortunate to work for another naturopath when I came out who shared some knowledge with me, but people didn't talk. People didn't talk. We were all in like some fake competition. Like I was worried that the people in Param were going to take my patients in Mornington, or, you know, like silly stuff. And so I love how far our industry's come with all this collaboration. And it was one of the key reasons that I did Vote Vita Mosaic, and that I do the presentations that I do when I'm asked, because imposter syndrome and just not feeling good enough is 100 times worse if you have no one to talk about. Like there was no internet. We couldn't well, there was, but we couldn't jump on and ask a naturopath what to do, or for advice, or what supplement you'd use instead of this, or just have the chats that we have. And so I think this kind of information is gold for graduates, because it means you do have someone to ask. We literally got the ATMS or whatever association you're with magazine, and we got the MediHerb brochure, and the rep would come and see, like the rep was the closest you got to someone helping you. And so, you know, I think embrace this, and embrace the knowledge of the people who have stepped up to share it, because we have imposter syndrome too, but we've stepped up because you know, we want to help the industry grow, and for everyone who we teach who helps a patient, it gives me that feeling that I've helped too. So I'm sure you're the same, you know.
Absolutely. I remember going to a conference when I was training. They had a conference, it was an NHAA conference, and we'd never been to Canberra, and Floriade was on, and it was in Canberra. So this is a really long time ago. Maybe I'd finished. I think I'd finished actually, but it was my first ever NHAA conference. So we went, and I said to my husband, I only want to go this one day. And he went to conferences all the time, and I'd only been to a few nursing ones, and as a nurse you'd sit there and it would just be the one, they'd just get up, there'd never be other rooms or anything else happening. And I'm pretty sure it was that one, or it might have been one after, but I went in, and this woman stood up, and she'd seen this complex case who had, I can't remember what it was, and I can't remember even vaguely actually what the issue was, and she got up and she told the story, and then she said, but I'm not telling you what I did because that's my information.
I've heard of
And
this
I was just sitting there going, you're kidding me, you're kidding. I've come to this conference, everything you share, you're meant to share so that I can learn, and I've paid. So I actually got really, really grumpy, and that's never happened before or since. So I think I must have been to one prior to that one. So maybe it wasn't the Canberra one, because I was stunned that she said it. And I commented, I said, you can't come to a conference and then not give me that information. That's not proprietary. And coming from a nursing background where it's all about helping everybody, a new person comes in, you're showing them everything, because that, if you've shown them everything and you've done everything, it means it actually lightens your load.
I had a student in with me. I think it was a Southern School student sitting in with me. They have to do a little bit of observation, and I thought the student practitioner wasn't that interested. I thought she was finding me boring or something. She never wanted to kind of look at what herbs I was making. She didn't come out when I mixed them up. She didn't, I don't know, I thought we didn't gel. And after the end of the second day, she said, would you mind if I looked at what herbs you're mixing and what you're prescribing and your notes? And I was like, no. And she was like, oh, the other 2 naturopaths I've sat with wouldn't let me look at their formulas or their notes, because it's like their property.
See, it's nobody's property.
It blows my mind. Yes,
this is nobody's property. There are how many billions of people in the world that need our help, and they don't have to be and I mean, I share clients with people. So Deb is on the conversation in the group at the moment, and I've sent clients to Deb.
Yes.
Well, you know, because they're not my person.
Yes.
You know,
look at my practice. We've got six practicing naturopaths. And you know, like the other day I was really, really busy, and one of my patients went and saw Kimberly. And I don't mind, like, you know, when your doctor's sick, or away or not working that day and you need to see them, you don't worry who you see. You just want to see someone, you know. And so there's a lot to be said for sharing the load, especially if you're looking to gain confidence, working with someone, whether it be in a mentorship relationship like you have, or a colleague. You're only going to, you know, be twice as good, or whatever the amplification is of the work you do together.
Yeah, I mean, I share as much as I can. Anything that I can share, I totally share. I mean, it's all going into the academy and into the graduate mastery program, and but you have to, and it's so important. People say, I wish I'd had something like we're both delivering when they came out of practice. I mean, at the end of the day, you could sit here and say, well, we're competing for the same dollars from the same people, but I don't care, because I want my people to do my course and I want them to do your course, because they're going to get so much different information from both.
Yes, I say at the start of my course, it's really, you know, this is just not how you have to do it, it's how I did it and how I found it worked. But, you know, if we had someone attend both of our courses, and there's been people that have done this before with other things you've done, I'm sure they're getting different things from different people. And you pick up bits along the way and you go, hey, that wouldn't work for my clientele. You know, if you see children and have a special interest in children, like your background is, doing the whole timeline with them, it might not be necessary, because they might have a little tiny timeline, you know, or you might not want to spend an hour and a half with the mum that's just had a newborn baby who's just trying to breastfeed during the consultation, and you know, the toddler running around, you know. So tools that you provide and I provide, I think, mesh, but also different people will pick up different things out of the training.
Totally. I mean, they do. And because you always learn, you learn from so many people in so many different ways. And because we're not industry, it means that they're getting independent education. There's so much industry education, and industry tends to have a set way. You know, you've got to use my product, so this is why I'm going to tell you about this, rather than we sit around and go, well, there's 20 different products that you could use for the same thing, but what is it that this client needs? Is one of them better than the other? And so it's all about sharing. It is totally all about sharing as much as we can and giving as much as we can to everybody who's out there. The people in the chat at the moment, I've just had a look at the chat. So we are going to upload this to YouTube. So I'm sorry, YouTubers. You won't see the Facebook chat. But, you know, Soraya Ziegler, she did your course and my course. So, so Deb hasn't done either of our courses. She's been in practice for years, Deb, 20 years as well, I think. So, but, you know, she's absolutely so valuable what you both offer to prackies. So, you know, and there's lots of that in the chat right now. And we love what we do. And I think it comes out with everything we do. And that's, 2 months in the academy for the
I think
Vita
that's
Mosaic.
amazing. Thank you so much. Thank you.
I thought that'd be nice. I'd like a new influx of people knowing that what they're doing as well. So I know sort of where they're at and what they're doing, because they're doing the Vita Mosaic. And so it'd be really cool to
that sounds amazing.
For a couple of months.
Thank
so
you.
Anyway, I guess have we got any questions in here? We've got quite a bit of chat. We've had a lot of eyes on the prize, as I like to call it. We got up to 18. We're down at 14 people now. So if you've got any questions, anybody, then please pop them in the chat. There's 44 comments. Gosh. And of course, I can't see them all. You can only see what's come up in the last minute. So if anybody's got anything that they'd like to put in there, I'll be able to see it. And there's a lag as well. Oh, Deb just says she's loved this session and she's learned a lot. Hey, Deb.
Thank you.
Thanks,
One of the things I say at the end of Vita Mosaic, when we used to do the lives, we have a little bit of time left over at the end, and we try and do that in the Q&As each week with Vita Mosaic, is ask me anything, because that's part of that sharing. Sometimes people don't want to know about Vita Mosaic. They want to know, what do we charge? Here we go. I could be opening a can of worms here for you, G. What do we charge for our acute consults? Or how do we get around making sure that what we're doing is, safe and ethical? Like, I'm happy to share any of that. So those are the things that sometimes are the type of sharing people need. And I'm sure you cover those kind of things with graduates, because sometimes they're the little bits we get stuck on. Rather
there's
than
all the
stuff.
We've got a challenge actually in the academy starting on the 1st. So it's
Yes.
free for 7 days, so anyone can join. And in that, there is some financial stuff as well and working out. It's just a simple one, but in the academy, there is actually some videos on how to work out how much you should be charging.
Yeah.
So,
Excellent.
and working out your finances. So now Katrina, who does every course, she's a phenomenal studier, is our Katrina.
Yes.
She wants to know, I will put in the link, Katrina, for the Vita Mosaic, don't worry. And oh, it's just gone. Somebody just commented, I can't scroll back on my computer for some reason. I probably can on the phone. And someone just said they're doing both. And Christine, Stephanie, no, damn, I probably can see on my phone.
Yeah, have a look
So
on your phone.
yeah, I'll have a quick look, see if I can find it on the old phone, because it's very different to on that old computer.
I find connecting with people in courses too is another, you mentioned Katrina doing lots of courses, that I think is another strength of a course, and something that I'm sure you encourage, and I try and encourage. And I know when we have other courses like NatX and places that we've been together, when you go to a course, that's another way to find your people. Like G and I are good friends, as are, Jules, and there's a little group of us. Make your own little group of like-minded prackies. Maybe you have similar areas of interest, maybe you work in similar locations, because that can be a great support too.
It's when because I'm not lecturing now, because nobody is at Endeavour, it's all online, but at the end of the group that I would teach, I was like, right, have you got a messenger chat, or have you guys got a Facebook chat before you leave this class today?
Yes.
Because these are, that you've all left at the same time, you'll all do different things, and you may not be great friends with each other right now, but it's a great support network, to start. So Chelsea Pickering, she's doing both courses.
Excellent.
And she says, yes, if we had this back when I graduated, I might not have had such a long time between graduating and going into practice.
Yeah,
totally true.
I wonder
totally
what
true.
Chelsea's she might not want to share, but I wonder what her reasons for that is. And I think very often it is that can I do it feeling. And obviously, and I'm sure you cover this too in your program, if you're going to rent and you've got to back yourself with some kind of setup for a clinic or a dispensary or whatever the costs involved are, that can be a really big hurdle to jump over if you're unsure of how you're going to start and move forward.
Yeah, totally. I mean, it's a bit easier now in that we can, work online. So I started out at home because I had little children. So I was the lounge. So Christine's doing the Vita Mosaic in Feb, Christine Jasper, she's doing it as well. She's in my academy as well. So, oh, Amanda, thank you. You're both awesome. Thinking about follow-up with clients is so important. Yes, absolutely. The, what was I even saying? I shouldn't be trying to read.
You were saying that you started at home. This room.
Oh yeah, I started at home, and because I had small children.
Yes.
So I couldn't really go out into the world. But back then, people used to say things like, oh, it's not very professional being at home. And then in the last 5 years, being at home has been totally okay.
Yeah.
And now 2020 has made being at home and online totally okay.
So this room I'm in is, we built this house, and this is a front formal living room, but it's not now because 2020 it became the whole dispensary. But we built it to work from home, so I didn't have to pay the rent, the big dollars, but I also could be around my children. So yeah, I think it's a totally good point. There's lots of ways to cut those costs now.
There's lots of ways, and people are up for negotiation. I don't think people realize, if you're going in somewhere new and you're brand new and new to practice. So when I rented my room, I went in with somebody else, and we had a terrible location, a terrible spot. All of the things were wrong. So, and that's in my podcast.
Sharing those, I was going to say, you sharing
in my podcast. All of the things were wrong. I didn't do any of the things that I tell people to do myself because I got overexcited. And but a banker said to me, because it was a 3+2 contract, which meant you have to have it for 3 years, and then you have 2 at the same rates if you want. And a banker said to me, why don't you ask for 2+3? So we were able to get out at the end of 2 years. And it's those little things that helped me get out of that situation, but when it means all negotiation is possible. So if you're moving into a chiropractor's room, and you haven't got clients and you don't know what the referral base is going to be like, then our friend, one of the very well-known naturopaths here in Adelaide, I won't mention any names because she might not want to tell the world, but she started out in a facial place, one of these really popular, not in Doda, but like them, I just can't remember the name of the brand right now.
Yes.
And she used their room one morning a week, and she gave $10 of each consult to them. So because it was $80 a day, she said, well, I don't have $80 a day at the moment. How about I give you $10 for every consult until I get up to $80 a day, because that would be 8 clients, and then you'd have your $80. And they were like, yeah, okay, fine.
Yes.
All negotiation, we have to use those negotiation skills. Don't think it's set in stone.
But even that thing you just mentioned about the swapping the 3-2 deal to 2-3, if like me, you didn't have a career before naturopathy, and maybe this isn't just me blaming it on that, there could be other reasons, and you don't know that kind of stuff. How do you find out? Like, that's I'm sitting here going, oh my God, that's such a good idea. I need to do that myself with my landlord. So, you know, sharing those things, that's just golden.
It's gold. It's absolutely gold. So Chelsea says, we went traveling after I finished, but then came back and have moved away from where I studied. Didn't have confidence, but also didn't have a support network to get that confidence. Age and life experience has helped that, as I was 23 when I graduated. It's amazing to me to find this huge online support network when I did make the decision to start.
Yay,
totally.
I love
Totally,
that.
Charles. That is beautiful. That is totally brilliant. Yeah. Because I mean, that's what so many people do as well, because it takes so long to get the degree. One of the reasons that the colleges don't last and they struggle is because most of us are mature students. So a university, so University of Adelaide, Flinders University, Melbourne, you know, all of the big universities, everyone takes around 4 years to get their degree finished.
Yes.
The average at Endeavour is 8 years, which means that they might look like they've got however many thousands of students, but they haven't really.
No, because they're slow.
Because you're so slow to go through. So the yearly intake,
the loading
is very, very different. And because so many people get pregnant during study or at the end of study, it means they don't start. So it's those people, you know, and these really, really part-timers that really struggle with confidence and think, I could just go out and work in a shop, but I really want to do this. I've done all this training. I've spent 60,000 on my training or whatever it is. And I want to do the job. And so joining these trainings that we have is what really, really helps them.
Yeah, definitely.
So,
no, I often say I wish that was available when I graduated.
Totally wish. I mean, I was just so stunned after coming from nursing and getting all that support on the ward and being all these people and everybody sharing and saying, well, don't do it like that, do it like this, or this is a faster way, or no, you don't want, you know, all of these things, and then coming out and going, hi, bye. Can anyone help me? Oh, well, I'll think about that. I'm not sure. You know, like Tracy Cook in Adelaide is very similar. She has an apothecary style business. She takes people sitting next to her. She will show them everything. And it is just, it's hard to get in with her because like you, there's not as many people who are great at sharing and are willing to share that information because they understand that your clients come to see you because of who you are. And if they see someone else, they'll be seeing them for something different, chances are.
Yes. Yeah.
You know, and you know, you see different people for different things because you resonate in different ways.
Totally.
So, yeah.
Yes.
Anyway, I think we've been on for a good long time. I will, 47 minutes. I will
we can
hopefully
talk underwater, G.
And talk underwater. Maybe I'll put this up on the podcast as well so that the people listening to podcast will get it. But unfortunately, none of you will see the information at the bottom. But just to know that Strictly Education as Support is the Facebook group that I hang out in and do lives in as well. So happy Australia Day. Are we allowed to say that, or should we just say happy public holiday day?
Yeah,
because I've heard a good one. It should be May 8. Mate.
Yes.
So we've got to have May 8. So right, because that's Mate Day.
Yes.
So yeah. So it is a public holiday today, and so I've been able to catch up with you and catch up with lots of people who got to watch and listen, and we will get this out into the ether as well so that other people in other groups can see it.
Thank you so much for your generous offer too. That is awesome. I'm sure everyone's going to love it. And also thank you for all your sharing, because we have to be brave when we decide as pracs to step out and you know, do our how we do it, you know. And so thank you too for sharing.
Well, thank you. It was absolutely wonderful talking with you, Carla, and I really look forward to catching up with you very, very soon.
Awesome.
See you, everybody. Bye.